Well, the Department of Health's Acting Chief Director for HIV/AIDS and STIs, Petros Khoza, says it is concerning that there is still a substantial number of people who are HIV positive in the country but are aware of their status. Khoza was speaking on the sidelines of the official World AIDS Day commemoration, which is being held at Mandeni in KwaZulu-Natal. This week, the Human Sciences Resource Council says KwaZulu-Natal has the highest percentage of people with a viral load suppression among those living with HIV in South Africa. This data emerged in its 2022 South African HIV Prevalence, Incidence, Behaviour and Communication Survey. Now, let's discuss this. We are now joined via Teams by Dr. Juliet Turner, Senior Technical Advisor at the Rights to Care. Dr. Turner, thank you so much for your time on the show. Of course, I want us to start unpacking, that recent research by the Human Sciences Research Council of 2022. I mean, we do know, of course, concerningly, that South Africa has the largest HIV epidemic in the world, with KwaZulu-Natal, of course, bringing in those worrying numbers in terms of the highest percentage of people with a viral load suppression among those living with HIV in South Africa. Where are we making strides as a country, and where are some of the challenges?
Thank you very much for having me on today. I think the first thing is to notice where we are making strides, as you've mentioned. As you heard just now, our 95 targets, we have dramatically improved since 2017, when the previous household survey was performed. Then we were at 85% of people with HIV knowing their status, whereas now in the 2022 survey, we are at 90%. We were previously in 2017 only at 71% of those people being on treatment, whereas now we are at 91%. And those who are on treatment, previously we were at 87% viral suppression, and now we are at 94% viral suppression. So this does mark a huge improvement in our HIV status being known, being on treatment, and viral suppression. For those of you who aren't sure what viral suppression means, it means that when we take the blood of an HIV positive person who's on treatment, their blood will not show HIV in the blood. And that means that their ARVs are working so well that we cannot find the HIV in their blood. They still have HIV, but the ARVs are working so well, it's not in the blood. And this means that they won't transmit HIV to their sexual partners. And that's the goal of our 95 targets, so that if we get everyone onto treatment and their viral load is suppressed, they won't transmit HIV to others. That's how we can end this HIV epidemic.
That is indeed, some positive news, which gives us a little bit of confidence. Just talk to us about then where the challenges lie. I mean, I don't know how much of the Deputy President's speech that you've heard. He does raise some concerns, particularly in as far as KwaZulu-Natal, in terms of, where some of those high prevalent cases are, particularly amongst adolescent girls. Just talk to us about some of the challenges that still exist within the country and what some of those drivers could be.
Yes, so we have some inequities. So unfortunately, our gaps are that we have some geographic inequities. So KZN, Mpumalanga, Eastern Cape, Free State and Gauteng have the higher prevalences of HIV out of our provinces. And unfortunately, still it is our female Black Africans who have the highest prevalence of HIV. On average, they are at 20% compared to males being at 10%, females to males. And Black Africans being at 20% overall. But our young adolescent females, they are the ones who are contracting HIV with the fastest incidence. And that is really where we want to target a lot of our support and efforts into protecting our young girls from developing HIV. We see them come in from age 15, where the prevalence is about 3%. By the time they reach 40 years old, the prevalence is up to 39% of them have HIV. So we clearly need to do something between those ages, from young adolescents as they make their way up to youth and adulthood. We need to protect these women from getting HIV.
And of course, the country is being warned essentially not to be complacent when it comes to HIV, interventions. The Deputy President also officially launching today the South African chapter of the Global Alliance to End AIDS in Children in a few years' time. Just how feasible is this particular, mandate for South Africa, and where should the focus be?
Yes, so the Global Alliance is really exciting, and I think it is feasible. I think that we can end HIV in children by 2030. I think we all thought that the 1990 targets were unachievable, and we've got there and surpassed it. So I think this is another achievable goal for us. We've already seen that our mother-to-child transmission used to be over 30%, and we've managed to bring that down to less than 2% in South Africa. So less than 2% of the babies born to HIV-positive women actually end up developing HIV. And that's phenomenal. And I think we can even close that gap further. We can try and get it to zero. We do that by testing firstly, preventing unplanned pregnancies. We want all women to test for HIV. If they have HIV, they must get onto treatment. If they want to fall pregnant, they must achieve viral suppression before they fall pregnant. So we should plan our pregnancies. Then when you have a planned pregnancy, you keep the mother on treatment. You keep them virally suppressed. You test them throughout. Those who are HIV negative should be tested for HIV throughout. They should also be encouraged to take preventive treatment. We now have PrEP, which works fantastically, 95 to 99% effective. Someone can take one tablet a day and prevent themselves from getting HIV. And we, in the near future, we'll have injectables as well. So you can take one injection every 2 months and prevent yourself from getting HIV. So in this way, we can prevent women from getting HIV while pregnant or while breastfeeding, because that is where a lot of our children, our babies, are getting HIV. It's from women only getting HIV at that time. So if we prevent them getting HIV, those who have HIV, we get them on treatment, then the babies born will have very, very, very small chance of having HIV. We also give infant prophylaxis as well when they're born. So I really think that this is an achievable target for us. We can prevent babies getting HIV in the future.
I mean, that is great news, particularly when you speak about prevention. But there's been a lot of questions, of course, in terms of where are we at in terms of eradicating HIV/AIDS completely, in as far as, some form of a cure for HIV/AIDS. Do you know at this point in time where we are globally?
So this is a less promising topic. But I'll tell you soon that I don't think it matters. But our scientists are working really hard at trying to get a cure and trying to make a vaccine. And over the years, we've had a lot of scientific breakthroughs, a lot of strides. We get excited, we think we're getting there, but then things have not worked out as we would hope, and nothing yet has proven successful. But they are still trying, and I think we will get there in time. But the good news is that we don't need the cure to end the HIV epidemic. As I've said, if we get everyone tested for HIV, on treatment, and with their viral load suppressed, they will not spread HIV. So they will not transmit it to anyone else. And they are now living completely normal, healthy lives. There have been some interesting studies that have compared people with HIV to those without HIV, and guess who lives longer? The people with HIV are, in some studies, living longer than the people without HIV. And that's just because they're going to clinic, they're taking their treatment, and they're getting tested for blood pressure and diabetes and all sorts of other things. So that shows how well our treatment works. If people take it every day, they can live a completely healthy, normal life with normal life expectancy. So that's our goal here. And with that, you almost don't even need a cure, because you can take your 1 tablet a day at the moment. And in the future, we'll also have injectables for that, or long-term implants, or things like that, where hopefully people only need to take something once every 2 months, or ideally maybe once every 6 months. And that will look after their HIV for them, and it won't interfere so much with their daily lives.
I would imagine those numbers would be even better, if we had to eradicate the stigma around HIV and AIDS. But Dr. Turner, that's all the time we have for this afternoon. Thank you so much for your time. Really do appreciate it. Dr. Julia Turner is a Senior Technical Advisor at Right to Care.